Hi, I'm going to be performing a pap smear today, an example of how it would be done and the steps to do so. Um, for the purpose of this video, I'm going to walk through like I'm talking to my client Olivia. I don't have anyone here, so I might be bouncing back and forth between role playing and explaining what I'm doing as a provider. So, hi Olivia, thank you so much for coming in today. I hear that you need a pap smear done. When was the last time you got a pap smear? And have you ever had any abnormal pap smears in the past? So I would have her answer those questions, and I would really make sure that all of her questions that she needed answered were answered before we even started the exam or kind of talked about the exam. So again, I would ask her when her last pap was, if there was any abnormal paps, any history of cancer in your family, any history of cervical or breast cancer in your family, and then I would ask her about, so she would answer those, and then I would ask her about any concerns about her fertility cycle, menstrual cycle. Have they been normal, abnormal, any bleeding in between cycles, any pain during intercourse, any bumps, lumps, or anything that she wants to talk about or is concerned about today before we start the exam. So once I've answered all of her questions and she feels ready, I would let her know that she can undress from the waist down, that I'll step out. There's a blanket here, and you can just sit up and I'll be in and we can get you positioned. So at this time I would leave the room, and when she comes back in, I would want to make sure that she is covered, and whenever she is ready, we'll start the exam. So Olivia, I'm gonna have you lay back on the table. I'm gonna have you put your feet up on the edge of the table. I'm assuming that I would be using a massage table type of style and not a doctor's office with stirrups. That is what we have in our office, so that is what we use. So with the massage table, I'm gonna have you scoot your bum all the way to the edge of the massage table and keep your heat and feet, your heels up on the edge of the massage table, as close to your bum as you can. So I would have her scoot her bum down, and okay, so the first thing that I'm gonna do is I'm gonna put my gloves on. And I don't have a pelvic model here today, so we're just gonna pretend that that I am have a pelvic model and I can explain what I'm doing. So first, Olivia, what I'm gonna do is I'm gonna insert 2 fingers. I'm going to feel for any like bumps or lumps or tenderness in your vagina, and any concerns or problems with your cervix. I'm gonna feel around. Hopefully we'll find nothing and everything will be great today. But I'm just gonna put some lube on my fingers, and whenever you're ready, you can let me know. So are you okay with me doing this exam today? Do you consent to me doing this exam? And you tell me when you're ready. So normally I would put my hands right on the edge. You're gonna feel my touch on your thighs, and you let me know when you're ready. For the bimanual exam, I would insert 1 finger, and then I would insert 1, and then I would put my other finger in on the side. Kind of hard to do without an actual model. So 1 finger and then my other finger to the side, and I would feel in the vaginal wall. I'm feeling for the vaginal wall. I'm feeling for any concerning feelings. I would spread my fingers. I would ask Olivia, can you please cough? When she coughs, I'm going to be visualizing for any bulging, any signs that her urethra, any concerns there, any signs of prolapse, so any like heaviness or bulging that I feel when she does that. And then I'm going to feel back. I'm going to feel her cervix. I'm going to feel, is it smooth? Is it bumpy? Is there any bumps or lumps on it? Any super tender spots that you're concerned about? Hopefully all that would be no. And with my fingers in the vaginal wall, I would take my hand on top of, right above her pubic bone, and I would gently press, pushing gently with the palms and like the plantar of my fingers. I'm going to be pressing up. I'm going to be pressing down with this hand. I'm feeling for her uterus. If I'm feeling it between my fingers, I should be noting the the size, the roundness of it. Is there, again, any bumps or lumps on it? Any spots that are really tender when I'm doing this exam? Those would be the questions that I'm asking her. If I'm not feeling it, I can move my hand a little bit more up and push down. And then I could always push to the side, either side, and kind of seeing where that uterus is. And then when I'm doing that, again, I'm asking for any pain or any concerns. So I don't have, oh, I have a tissue. For the purpose of this video, I'm just pretending we didn't do that and pretending I'm putting on a new pair of sterile gloves. I don't have a new pair here. So pretend I'm taking these gloves off and I'm putting new gloves back on. Next, I'm going to do the speculum exam. Olivia, have you ever had this done before? And any concerns that you have with me doing this exam? Hopefully that will be no. For the speculum, you want to make sure that it's warmed if possible. You also want to make sure that you do have a lubricant. There's been research that suggests no lubricant because it can mess with the exam. But the research isn't exactly, there isn't a lot of evidence out there that supports this. So I would want to make sure that there's lubricant on this for them. So, okay, when I'm doing the speculum exam, my speculum needs to be closed. And I'm going to tell Olivia, whenever you're ready, you're going to feel my touch of my hands on your palm. And you're going to feel me inserting the speculum. So when I insert the speculum, tell me when you're ready. So she would say, ready. You take your fingers on the posterior part of her vagina. And I'm going to push down, gently push down. When I'm gently pushing down, I'm entering this into the vagina like this, and then I'm gently turning it at the same time. You want to make sure that this remains closed until you are into the vagina. When I'm into the vagina, I'm going to gently open this. I'm only opening it until I visualize the cervix, so I don't necessarily need to open it all the way, but just until I see the cervix. So once I see the cervix, I can stabilize this with my screw right here. And then, okay, so I'm gonna look at the cervix. I'm looking to see what its shape is, if there's its color. So is it super red? Is it super tender? Does it look painful? Does it have any lesions on it? What is the size of the opening of the cervix? Is it round? Is it U-shape? If it's round, it usually means that it's a prime mom. If it's U-shape, which it should be with Olivia because she's a G1P1, so it should have a little smile looking at us. I want to visualize that. It should look closed. It also should look, like I said, no redness, no bleeding, anything like that. So when I'm doing this exam, so I'm going to see that she has her, that I can visualize her cervix. I'm using this broom. I'm entering the broom tip into the cervix and I'm going around 5 times for 5 seconds. So I'm going to visualize this. You don't want to touch this on any other part of the vaginal walls. So I'm inserting that into the cervix and then I'm twisting 1, 2, 3, 4, 5. And then I'm removing that and I'm putting this directly into my cup. That has the cells on it from the cervix that will test for any cancerous cells or any concerns. So you did great, Olivia. I'm going to remove the speculum now. So I'm just going to gently release my screw. And then as I release it, I'm going to turn it like this, and I'm gonna pull back out. Also putting pressure on the vaginal wall just to make sure that that I'm not like pinching any of the skin, and that I'm just not like pulling this out quickly, and I'm not pulling this out open. So that would be it for our speculum today. Great job, Olivia, and your results will be to you in a couple days. Do you have any questions, any concerns, any anything else that you wanted to talk about today, anything that I didn't follow up on or answer for you already. Okay, that's all I have for you.